hospital, a patient's fever suddenly spikes. Far away in the Middle East, a man arrives at the hospital. The attending resident diagnoses him with pneumonia and orders antibiotics. She asks for him to be intubated immediately so that a ventilator can assist his breathing. The doctor prescribes antibiotics, and the nurses bring an intubation kit. Gasping for air, the patient waves his arms and shakes his head, no, adamantly refusing the intubation. The American man refuses the intubation too. Doctors attempt unsuccessfully to persuade him. Still vigorously refusing, he loses consciousness. Doctors, nurses, and family continue trying to convince the Middle Eastern patient to consent to intubation. The harder they press, the more stubbornly he resists. Soon, he loses consciousness. Immediately, the physician seizes the opportunity to position the plastic tubing. The doctors pause and then write, "Patient refuses treatment," on the chart. The man dies a short time later. In the East Coast Hospital, the patient's condition rapidly improves once he is on the ventilator. The physician comes to his side and tells him that she will remove the tubing now. She slides it out of his mouth, and the man hoarsely coughs. Then he meets her eyes and says, "Thank you." Two men both panic as they gasp for breath, refusing a simple procedure that will save their lives. One doctor respects the request. The patient dies. The other doctor ignores the patient's stated wishes. He lives. Traditionally, medicine has been paternalistic, with doctors using their professional judgment to decide what is best for patients. One of the pillars of modern medical ethics is autonomy, a patient's right to information, to make their own decisions regarding their treatment. But is this always the wisest course of action? The most ethical? The most humane? Should autonomy have its limits? We'll find out in Lesson 1 of Medicine and Morals.